One of the things that I think is really holding back us making progress on tackling with and thinking about COVID-19 in Canada is media amplification. What do I mean by that? Well, I have an iPhone, an Apple product, and I have that Apple News thingy on the phone. I should probably turn it off, turn off the notifications, but the default is that it's on. I imagine that's the default for many people. So I get this ping when big news happens, when a celebrity dies or a big piece of government legislation is introduced and so forth. And I've been getting pings about certain coronavirus news. For instance, I got a ping to say Quebec introducing vaccine passports a few weeks ago. Now, if something is going to ping right on your phone screen, it's clearly really bringing it to people's attention. I mean, everybody, whether or not they want to be plugged into the news, there it is right in the front screen of their phone, and it sort of provokes them to think about it and maybe start talking to the person beside them. Oh, look at this. Look what Quebec did. Why aren't we doing it in Ontario? Maybe we should do it in Ontario and so forth. And then they did do it in Ontario. And that's the stuff that is amplified. That's the news that is really pushed in front of people's faces. And it's telling about the things that are pushed in front of people's faces and then the news that is not. There's a lot of stuff about COVID-19, very factual based government statistics, things various medical experts have said that I think are really important to us understanding how to learn to live with COVID, as a number of chief medical officers of health have said throughout Canada, how to make positive progress, how to get on with our lives, information that would be so helpful to help us with that and to help the public understand why it's okay to do that stuff and help them understand why it's important. But that information has not hit critical mass. It is not being amplified. There's one thing that I used to write about, I wrote about several times. I wrote a number of columns about it, coming up almost a year ago now, which is about the Alberta comorbidity data. I say Alberta data because other provinces don't disclose as well as Alberta does. But right there on their government website, their COVID-19 fact sheet website, they break down the comorbidities, so the serious underlying conditions connected with people who have had serious outcomes with COVID, and tragically the people who have died from it. And it has pretty much been consistent throughout dealing with COVID-19 that 3/4 of the people who have died of COVID-19 have not just had an underlying condition, but have had 3 or more underlying conditions. Currently, as I record this, the statistic is 76.2% of the people who have died of COVID-19 in Alberta had 3 or more underlying conditions. The percentage of people who did not at all have any underlying conditions is 3.2% of Alberta's deaths. So that's an interesting statistic that I would say most people in Canada do not know. But they should know, because that information just helps us understand a bit more about how COVID-19 is being experienced, how it's unfolding here in the hospitals, in the ICUs among Canadians. It can perhaps inform us to better help people who are having serious outcomes, and perhaps also inform ways for low-risk persons to go and get on with their lives. But that is information that is not being encouraged in the media amplification stuff. That news is not pinging on your phone and being presented to you as, hey, here's something we think you must know. In fact, as some of you may know, I was bizarrely attacked for reporting that basic rudimentary data, and Patty Hadju, health minister, actually in the House of Commons, denounced that reporting as fake news, even though it's just Alberta government data. So they were very hostile to that information being discussed. So some info being amplified, being rammed down your throats, and other information completely accurate, very important information that is just not really being discussed out there as much as it should. Other people aren't sending it out there, picking up the ball and running with it. I'm not just talking about my own work. I'm not trying to say, complain why it wasn't my own reporting on the comorbidity data more amplified and so forth. I mean, that's just one example. There are many other examples and many news outlets who are reporting things that you go, hey, that's really important. More people should know that. And they just drop it. And it just fizzles away. And yet some of the information that fizzles away is the most integral information for people to understand. So very disturbing how media amplification is working or failing Canadians when it comes to COVID-19.